In this video, we are going to talk about the common causes of ear pain, ear discharge, how to diagnose and treat a eardrum perforation, and let's find out if we can treat a eardrum perforation at home. Namaste. I am Dr. Divya Badanidiyur. I am an ENT specialist at Pristyn Care, Bengaluru. Common causes of ear pain. The most common cause of ear pain is usually an impacted wax. Wax is normally soft and liquidy, but in some patients, the wax can get dry, hard and flaky. Even then, it comes out by itself. But in some patients, this wax can get accumulated over time, and this condition is called an impacted wax. This can cause pain, an odor, and as well as discomfort over the ear, decreased hearing, as well as a ringing sound. Use of foreign objects in the ear, such as cotton buds, bobby pins, hair clips, toys, and pencils to dig out the earwax can also cause ear pain. Infections of the ear canal, such as a swimmer's ear or otitis externa, as well as a fungal infection called otomycosis, can cause the ear to hurt. It can also cause discharge, as well as a sound or a buzzing sensation in the ear, itching, and pain. Other rare causes of ear pain are where there is a referred pain involved, meaning patients who have any dental issues like an infected tooth, an impacted molar, abscess or basically pus collection in the mouth can cause pain in the ear. This is because the nerve supply to the throat and the ear is the same. Similarly, recurrent infections of acute tonsillitis, pharyngitis can also cause pain to the ear. Sometimes ear pain can also happen because of issues in the jawbone which is there in front of the ear. This is called as a temporomandibular joint. Rarely, ear pain can happen because of tumors. These tumors can be non-cancerous as well as cancerous. Tumors involving the ear, the salivary gland which is in front of the ear, can cause pain, swelling, discharge. Certain serious infections such as cellulitis or shingles can cause significant pain in the ear. Let us find out what are the causes of ear discharge. Ear discharge is commonly seen in infections of the ear canal, such as swimmer's ear or otitis externa, usually triggered by water entering inside the ear canal and also by using earbuds to clean the ear. The most common cause of ear discharge, however, is a middle ear infection. Recurrent infections of the middle ear can cause fluid to build up in the middle ear. This can exert pressure over the eardrum, which can then perforate, and then the fluid, which could either be clear, bloody, or pus-filled, can discharge. Acoustic trauma, which is basically exposure to loud sounds such as firecracker, gunshots, or loud explosions, can cause a damage or a perforation of the eardrum. Barotrauma, which is basically a change in the pressure of the middle ear as compared to the external environment, can cause a perforation. This is seen during rapid changes in the pressure when flying or when scuba diving. Road traffic accidents can cause a head injury, which can cause a disruption of the eardrum as well as the bones of the middle ear. What are the symptoms of eardrum perforation? The symptoms of eardrum perforation are pain. Patients complain of a sharp shooting pain in the ear whenever the eardrum perforates. If the perforation happens as a result of an infection, then the patient feels that the pain has reduced. Patients also feel there is air coming out of the ear when they blow the nose. There is a significant hearing loss which happens because of eardrum perforation. Rarely, patients also complain of giddiness. Is there something we can do to treat a eardrum perforation at home? The first and most important point is to make sure that we keep the ear dry. Do not put anything inside the ear unless advised by the doctor. Please meet with an ENT doctor and follow all the instructions that they advise. This would mean using the medicines, the drops, in a timely manner and fashion as advised. What happens if you don't treat a eardrum perforation? Most eardrum perforations, whether traumatic or because of a single episode of infection, heals by itself. In case it does not heal, you may need surgery. If you ignore long-standing ear pain, ear discharge, it could be a eardrum perforation. This will cause a permanent hearing loss. So please avoid that mistake. You may also develop a recurrent or a chronically discharging ear. This becomes difficult to treat without surgery. Rarely, you may also develop a serious infection known as a cholesteatoma. Never ever leave a ear pain or ear discharge unattended. I hope this video has been informative. If you have any doubts or questions, don't forget to write down in the comment box below. Thank you.
Book your appointment on PristynCare.com. Pristyn Care.